Okay, so once food gets down to this sphincter here, which is not shown, which is the gastroesophageal sphincter, it is then within the confines of the stomach. The stomach is then going to end here at the pyloric valve or pyloric sphincter, because remember, all of these organs begin with a valve and end with a valve. Inside of the stomach are going to be stuff that make it look like a Shar-Pei puppy skin. These are called the rugae. The rugae are both in the stomach and also in the bladder. They are going to be, what I always like to think of them as a pleat in a skirt. So a lot of times as you get bigger, it's going to stretch out the pleat a little bit. So the rugae are going to be inside of the stomach, and the other thing to notice is there's 3 different layers of muscles. There's going to be an oblique layer, a circular layer, and a horizontal or longitudinal layer. So all of these are going to take the food that's now in the stomach and allow it to mix back and forth so that the digestive juices will start to break down the food. So every time, once the food gets in here, it's going to get to the pyloric valve or the pyloric sphincter. It's going to squirt a little bit out into the first part of the small intestine, and the first part of the small intestine is called the duodenum. Remember, all of these digestive things start with a valve, which is going to be here, the pyloric valve, and the small intestines end with the the next valve. But here is going to be the lesser curvature, which will go from the liver to the inside diameter of the stomach. And then the greater curvature is going to have, believe it or not, it looks like an apron hanging down over the small intestines to make sure that any bacteria is going to be contained if it ever gets stuck there. So I think we actually later will have a picture of the greater omentum. Inside of your stomach is going to be a whole bunch of cells that are going to secrete stuff. For example, there is going to be mucus cells on the surface up here and not down here. These are going to secrete a mucousy secretion that will coat your stomach. That's good because, remember, you're going to have hydrochloric acid floating inside of your stomach, and if it will eat and digest the food, why won't it go through the stomach? And in certain cases, it will go through the stomach lining, and that's called an ulcer. So the mucous neck cells secrete an acidic mucus. The parietal cells are going to secrete hydrochloric acid, which is going to begin the denaturing of protein. And the only reason that you need a stomach is because the parietal cells produce something called intrinsic factor. The intrinsic factor is important for the absorption of vitamin B12 in the small intestine. So a lot of people, as you get older, you start to lose some of your stomach mucosa, and a lot of elderly people end up having to get a vitamin B12 shot. Chief cells are also going to be in the stomach lining, and they're going to produce something called pepsinogen that's inactivated until it's been exposed to hydrochloric acid, and then the pepsinogen is converted into pepsin, and they're going to be responsible for breaking down lipids. There's a lot of other cells that are going to be in there, but the big one that's important is the mucosal barrier. And the mucosal barrier is going to be there so that it is not going to have something eating through it because of the stomach acid. So here is a picture of a gastric ulcer. So all of this shiny stuff here is the inside of your stomach, and here's an opening to that. So years ago, they thought it was just due to stress, although stress will aggravate the condition. They now know, because these 3 gentlemen got a Nobel Prize for finding out that these things that are kind of cute, which are the Helicobacter pylori, is a bacteria that is in the stomach, and they will actually eat through this mucosal layer and cause a stomach ulcer. So the interesting story about them getting their award is they found out that if you have an antibiotic and you take bismuth, which is a mineral, it will destroy the bacteria. And so how can you get bismuth without going to mine for it? Take Pepto-Bismol. It is made of bismuth. So that's what's going to destroy these H. pylori bacteria. So do you really need a stomach? Not necessarily, but the only stomach function, as it says here, is for the secretion of intrinsic factor for the absorption of vitamin B12. And if you don't have that, you get something called pernicious anemia. They can resolve that. Okay, so the stomach does a lot of things that are summed up in the lecture portion, but this is the lab portion. And the last thing I'm going to show you before we go on to the small intestine is, here's just a picture of the stomach, and I'll just pick this one. Here's the esophagus coming down to this valve, which is the gastroesophageal sphincter, and then here is the pyloric valve. So as food goes into the stomach, those three different layers of muscles are going to squish things forward and backward and forward and backward, and then eventually this is open because the food is going in, and then it's going to be closed while you're moving everything around. This pyloric valve is closed until we're going to have just a little bit to go through it in something called retropulsion. So the peristaltic waves that are going to be responsible for helping to break down the food that's in your stomach are going to at some point spit out a little bit into the duodenum. And so the duodenum then will evaluate whether or not it's okay or should it go on from there. One of the accessory organs is the liver. The liver is going to secrete stuff that's going to help break down fats particularly. But anatomy-wise, it's only got 4 lobes. This big one here is called, on the right side, is called the right lobe. The littler one on the left side is called the left lobe. On the inside, you got the 2 other lobes, and the easiest way to think about it is this part here is the gallbladder. The lobe that's located next to the gallbladder is called the quadrate lobe, Quadrate. The other lobe, or the 4th one, is going to be the caudate lobe. So the caudate lobe is going to be between the left and the right lobes of the liver. And the easiest way to remember is the gallbladder is always this green thing down here because it secretes bile. The lobe that's next to that one is called the quadrate lobe. Here is kind of what a section of a liver looks like. The easiest way to think of it, I think it looks like a beehive. So it's going to have in the center, this little white thing is called the central canal, or central vein. And then all of the septums are going to make up a 6-sided figure. So we got 1, 2, 3, 4, 5, 6-sided figure. And to me, it always reminds me of a beehive, and in the center would be the central vein. Here's actually a picture of what the central vein does. So as food goes through your liver, it kind of percolates through all of this tissue, which is a really dense tissue. And at the corner of every one of those 6-sided things is something called a portal triad. The portal triad will always consist of 3 things: a bile duct, a portal venule, and a portal arteriole. So you got the artery, the vein, and the bile duct. They are all going to be at each corner of those 6-sided figure, and they're going to percolate the food through the liver. Your liver produces almost a liter of bile a day. This thing says 900 milliliters, that's almost a liter. And so it does a couple of things. One, it's going to process nutrients. It's going to store fat-soluble vitamins. And probably the more important thing is it's going to do something called detoxification. A lot of time when food goes through your body, it's going to change it into something that your body can't use. For example, ammonia is not something you should have in your body, and so the liver will convert the proteins into something called urea, which is less toxic than ammonia. The bile itself is going to be a yellow-green alkaline solution, and it tastes nasty. If you've ever thrown up after drinking alcohol a lot, it tastes terrible. but it's going to be responsible for breaking down fats. So when we finally get to what it looks like, and there's a picture coming up here. I guess there's not. Here it is. Okay, so on this one here, remember the small intestines are all over here. This is the duodenum, which is going to be around the head of the pancreas. And so here is this green gallbladder. Here is the larger right lobe of the liver. Here is the smaller left lobe of the liver. And then somewhere around here would be the quadrate lobe. So the liver itself is going to make bile. The gallbladder does nothing more than store and concentrate the bile. That is its main function. So it's making close to a liter a day. It's going to be stored here, and it's going to be concentrated. So as food comes through your small intestine, or gets into your small intestine from the stomach, it's going to spit a little bit out, and here is the opening here, the major duodenal papilla. And you'll kind of notice here is the bile duct and sphincter, and it's going to, as food goes through here and you need to break down the fats, it's going to squirt some out and it'll help break it down. In addition to that, this long line here is called the main pancreatic duct. It's going to come together at the hepatopancreatic ampulla and sphincter. So there'll be a little valve here to make sure that it's closed when it's supposed to be and open when you have fat going through this duodenum, which is this circular thing around the tail of, or the head, excuse me, of the pancreas. Here is the tail of the pancreas. So the pancreas is a heterocrine organ. It produces both insulin and glucagon, but in addition to that, it's also going to have a digestive function in the sense of being able to break down foodstuff that have come from the stomach and have now gone through here and gone from the duodenum into the next one that's called the jejunum. So that basically is what these things do, is break down stuff. Here is another picture of how some of this happens. Here is the stomach. Here, up here would be the gastroesophageal sphincter. Here is the pyloric valve. We're going to squirt a little bit out. There's going to be some things in here to check it, and you can kind of see the one drip of bile coming out of that ampulla at the sphincter. Let's see. One more. So that, actually the best way to teach this is going to be this picture coming up. And then I'll go back to that one in a second. So here it is. Okay, so the small intestines are all located in here. Remember, it's going to start at the pyloric valve and end at the ileocecal valve. So it starts at one, ends at the other. And so inside of these small intestines are going to be where you're going to absorb all the nutrients from the food that you're eating. And it's going to start at the pyloric valve, which is the end of the stomach, and it will go through there and absorbing all of those nutrients so that you can use them for energy until it finally reaches this valve here, which is the ileocecal valve. The ileocecal valve is now the beginning of the small or the large intestine, and the end will be the external anal sphincter. But let me just back up for a couple things to explain the small intestine to you. The small intestine has some unique features, and they have three unique modifications that will allow you to absorb food. One of them is built into the wall. Instead of being smooth, they're going to have something called the circular folds. Then in addition to that, you're going to have villi and microvilli. I like to think of the villi as my fingers, and the microvilli would be my fingers. So if you think of the circular folds, and each one of these is a villus, The microvilli would be on the outside of that. So there's a lot of surface area for absorption. So the circular folds are built into the small intestine. The villi are the finger-like projections with a core that has capillary bed and lymphatics. And the microvilli are on top of the villi, and they are going to be making it look almost fuzzy, like a toothbrush is on its edge. And it's called a brush border. It is so fuzzy that it kind of looks like this. So as food comes down this tube here, it's going to be exposed to all of these. So each one of these sticking up is a villus. Each one of these sticking up off of it are the microvilli. And the circular folds are built into the small intestine. So here is a close-up of what it looks like. So here, each one of these is a villi. Each of these is going to have on the surface of it a microvilli so dense that it truly does look like a toothbrush on edge. And then once the molecules of food go through it, it goes into, right here, it could be going into the green lacteal, or it could go into the bloodstream. And at that particular case, your food is now being absorbed by your small intestines. Here is actually another cool picture of the microvilli and all of the granules that are going to be responsible for absorbing everything. In addition to, we had talked about the lymph nodes at the beginning of it. There are also lymph nodes throughout the small intestine. They are called Peyer's patches. They are aggregated lymphoid nodules that are found in the lamina propria that are going to be responsible for making sure to reduce bacteria as it goes through your small intestine. The ileocecal sphincter or valve relaxes when it admits chyme into the large intestine. And there's a gastroileal reflex that enhances the force of segmentation into the ileum. There's actually a flap there that will be closed unless the chyme is actually making it allow it to go through it. And so that gastric motility is going to then get into the large intestine. The large intestine has three unique features that aren't seen anywhere else. And I'm going to go over the tinea coli, the haustra, and the epiplotic appendages. But for the most part, you are no longer absorbing food in the large intestine. As a matter of fact, you don't even need your large intestine. But you're going to have some divisions. And as I mentioned just a couple minutes ago, it kind of, to me, looks like a picture frame. So here it comes. Here's the beginning of the large intestine right at the ileocecal valve. Because remember, the ileocecal valve is also the end of the small intestine. The first portion of the large intestine is something called the cecum. It reminds me of a cul-de-sac on the street. So there's no way out, and there's only one way. And once it gets here, it's now going up and over and around and down and out. Hanging off of the cecum is usually an organ called the appendix. The appendix, we now know, is going to be filled with lymphoid tissue, and so as any food goes by it, it's going to brush against the opening of the appendix, and if there's bacteria in them, the lymphoid organ will destroy the bacteria. Because remember, we don't do too well with bacteria in our gut. So from the cecum, if there's food actually getting in here, it's now going to go up. And so all they did was just call it up. So it's the ascending colon. Then as I mentioned a little bit earlier, it's going to make a bend here. The liver would be right here. And it's going to make a bend at the hepatic flexure, which hepatic is referring to the liver, or the right colic flexure. Then we're going to go cross country from the right side over to the left side. On the left side, we're going to have the spleen or the splenic flexure, which would then go downhill. All they had to do was know that this tube is now going downhill, and they refer to it as the descending colon. So from the hepatic flexure bend to the splenic bend flexure, this portion right here goes from side to side, and anything side to side in anatomy is called transverse. It is called the transverse colon. So we have made it through the cecum. We've gone up turned at the right colic flexure up the ascending colon. We've then gone transversely across from the right side to the left side, made a bend here at the spleen, which is the left splenic or the splenic flexure, gone downhill, and we've now reached this area here that kind of takes on an S shape. And anything S-shaped in the body is called sigmoid. And then the sigmoid colon will then go into the rectum, which is going to have lots of stretch receptors. And then the journey of food will end at the external anal sphincter, which you have conscious control of. Okay, the three features that they were talking about of the large intestine are going to be these things here that kind of look like a balloon clown made them. These are called the haustra. The haustra have a puckering-like look to them, and that's due to this white thing that's going up and over and then down. That is called the tinea coli. It is made of smooth muscle, and so if there's a proper tone to the muscle, you'll be able to move the feces through the small intestine where you've absorbed all the nutrients, up the ascending colon, making the bend at the hepatic flexure, cross country from one side to the left side, down the descending colon, into the sigmoid colon, and then finally you have created poop, which will go into the rectum. The rectum will then, once it's convenient and you've been potty trained, have stretch receptors to say, okay, we need to eliminate all of this food through what you have control of, which is the external anal sphincter. The epiplotic appendages are fat that are hanging off of each one of these haustra and tinea coli of the large intestine. A couple other things that I usually talk about that no one else probably talks about is as you have food coming down into the rectum, there's going to be rectal valves in here. That's going to hold up some of the fecal material so it doesn't just leak out. And of course, as I mentioned before, these are going to have stretch receptors, and so as it gets full, it's going to be time to eliminate the fecal material. So the anal canal is just going to be under here, and so there are going to be two sphincters. The internal anal sphincter is going to be made of smooth muscle, and you are not in conscious control of that. So once food gets there, it's almost time. The external anal sphincters, which is on this side and this side, is once you've been potty trained, you are under conscious control of that, unless you have diarrhea or something like that. So you have conscious control of that particular muscle, and you usually won't go to the bathroom unless you have to go really, really bad. Here is actually a autopsy picture. You can kind of see the liver up here, the stomach, and all of this stuff that looks like cheesecloth is actually the greater omentum that hangs over all of the small intestine. So if you had, while this would be covering it, an opening here, and it was leaking out fecal material, it would get trapped in that greater omentum. And that's kind of the purpose of, they're showing here a cartoon picture of it. Appendicitis, some of you probably heard about that. It's an acute inflammation of the appendix. It usually is due to a blockage of fecal material that traps infectious bacteria there, and it can kill you, unfortunately. Usually there is pain in that area, and it is usually in the right lower quadrant. So if you remember the quadrants back in A&P1, you're going to have really severe pain on the right lower side. If it's really severe, you're probably going to be throwing up, you'll not be feeling well, and you're not going to eat anymore. So the surgical removal of an appendix is called an appendectomy. What they normally do nowadays is give you lots of antibiotics, because they can always cut it out later, but they want to make sure that it doesn't rupture and you're leaking out fecal material all over the place. Let's see. Interestingly, the bacteria that you have in your large intestines outweighs the bacteria that you have on your skin by tenfold. And so a lot of it is going to be colonized from outside of your anus. and this is weird to think about it, but the bacteria that you have on your skin sometimes crawls into your anus and will attack all of the undigested carbohydrates. You all probably have farted, because everybody has farted, and it's due to the fermentation of the indigestible carbohydrates. And as it says there, it releases irritating gases, acids and gases, about a half a liter a day. So everybody farts. The other thing that the bacteria does is it will synthesize some vitamin K and some of the B complex needed for producing clotting factors. But one of the things that's becoming really important with the gastrointestinal system is gut bacteria. They are finding out that your gut bacteria is incredibly important in maintaining body weight, getting rid of certain diseases such as diabetes, as it says there, fatty liver disease. And as the bottom one there, it also will influence your mood. So one of the things that they do is manipulate gut bacteria, and it may become something very common in the future. One of the things that's not good is if you get Colostrum difficile. It's an anaerobic bacterium that people may have in their intestines. And it's the most common core cause of antibiotic-associated diarrhea. And if you look at the number, it accounts for 14,000 deaths a year. So C. difficile can flourish, cause pseudomembranous colitis, which is an inflammation of the colon, which may cause sepsis, a septic condition where you end up dying. So one of the things that they do, and they do this here in the Lehigh Valley, is you can get a fecal transplant. Not that all of anatomy should be boring, but what they do is they will get somebody with good poop, they'll put it in a capsule, and then you'll swallow the capsule. So once it gets through your stomach, you now have good bacteria in your gut, and it really does work. The only reason I know how it works is because one of my students did the fecal transplant. She was part of the team. Anyway, so I did mention that the large intestine is not important for life, but it is kind of important to have for comfort. So if the colon is removed, the terminal ileum can be brought through the abdominal wall in a procedure called an ileostomy, and you can still be alive, but you might be carrying a bag around for the rest of your life because you're still producing poop, but at the same time, you're not getting rid of it because the large intestine isn't working so well. A lot of you have probably had haustral contractions. You can actually feel it, where it's a slow segmentation, where the stomach is kind of, it sounds almost like it's an alien creature, but in that particular case, you're taking a mass movement of stuff that you've already digested, all of the food out of it, or all the nutrients out of the food, and it's kind of working its way to the anus, and then you'll have a bowel movement. Most normal people who are eating a normal diet will have 3 to 4 bowel movements a day. Don't worry if you're not in that same average. Some of the other things, defecation is basically mass movement of feces towards the rectum. The defecation reflex is going to be under the nervous system control, parasympathetic signals of the autonomic nervous system. It's going to relax the internal anal sphincters. You are going to have conscious control of the relaxation of the external anal sphincters, which is a skeletal muscle, once you're potty trained. And then defecation is going to be using the muscles of your rectum to get rid of the feces, and it's usually associated by a Valsalva maneuver, which is going to be closing your glottis. We covered that in the respiratory system, and then increasing the pressure in the intra-abdominal pressure, causing the levator ani muscles to contract, and the anal canal will be lifted superiorly, allowing the feces to leave the body. And that ends our story of poop.